At the Women's Fund of Mississippi, we believe that when women are economically secure, safe, and healthy, then families and communities are economically secure, safe, and healthy. What does that mean?
So I was like, whenever this program starts, I want to be a part of it. I feel like the welding program will give me a lot more opportunities than home construction would in the past, because welding, you have so many shipyards, you have so many smaller companies that are doing welding with fencing and different things like that. On a professional level, I feel like women will be more accepted.
Well, this is the second class we've done this year. The first class we were working with Hope CDA, which is another nonprofit in the area in East Biloxi, and they work trying to help people who are still recovering from Katrina with their houses. So that was what our first Women in Construction class looked like. We were just going and volunteering for 8 weeks with Hope CDA on site at these clients' homes. So learning construction by volunteering.
Well, the main thing about the women in this program, I'm very pleased with the work ethic. I'm not surprised at the talent and all, but because generally women, they do catch on to welding very quick, because it's like a hand and eye coordination. And they do very well in it. And I'm just amazed at how they have bonded together and how they didn't know each other. A lot of them didn't know each other, but yet you wouldn't know it by watching them now. And they sit and they help each other, they encourage one another, and it's just wonderful.
The Mississippi Low-Income Child Care Initiative has been supported by the Women's Fund. We have been in relationship with the Women's Fund from the very beginning. Most of the families that we work with whose children need child care are single mother-headed families. Most of the staff in the child care centers that serve those families are women. So the population that we work with at the Mississippi Low-Income Child Care Initiative is women and very young children. Subsidized child care helps the children because it improves their long-term outcomes. Many studies have been done that show the benefits of quality early childhood education. Subsidized child care is good for their parents because it allows them to go to work and stay there. Child care is good for the economy. It's been shown by many studies that quality early childhood education is an investment that yields significant returns, as much as $7 or $8 in return for every dollar invested.
The work that we're doing here on the coast is directly impacting families who are underserved and underinsured. This is the Mississippi Gulf Coast Children's Health Project, which is a mobile van project for children concerning primary care pediatrics and mental health. What we try to do is to integrate the mental health and primary care pediatrics and the social needs of families so that we are truly providing a medical home. And in this setting, the mobile van, we actually eliminate access as a concern for our families.
Mississippi has one of the highest teen birth rates in the nation, and we've got to stop this epidemic. Reducing teen pregnancies is one of the most effective ways to improve child well-being and reduce child poverty. Comprehensive sex education is one strategy, but in a broader sense, it's important for teens to know that they have a future, that they have adults who care about them, and that they feel part of a community.
We really have to focus on women and children as we try to solve some of the problems with healthcare in this country.
People look at me and they see a middle-aged, middle-income, intelligent woman that just blends in with society. But what they don't see is that I am the victim of domestic violence. I think domestic violence impacts a community almost like a disease, almost like a cancer, because you can't really see the obvious signs, but you feel the effects. This is a dynamic program that takes women into safety, and from that point immediately starts nurturing them and their children so that they can be introduced back into the mainstream of life. Like I can say, after all these years, finally, that I am happy and I am self-sufficient, and it's all because of the Women's Center.
How do we ensure programs like these continue to strengthen Mississippi?
It takes me.
It takes me.
It takes me.
It takes me.
It takes me. It takes me.
It takes me.
It takes me.
It takes me.
It takes me.
It takes me.
It takes me. It takes me.
It takes me.
It takes you, and it takes the Women's Fund of Mississippi. We're dedicated to improving the lives of women and girls by supporting programs and advocacy initiatives that will bring about real, systemic, sustainable change. And we can't do it without you.